Hi, welcome to vlog number 2. Today, at the request of YouTube user Rage Against the Bath, I'm going to talk about my diagnosis of Parkinson's disease, which took over 15 years to get. So, why did it take so long? I went to see my doctor as soon as I noticed that I had some tremor in my hands. And again, when I started smelling a strange chemical smell that nobody else could smell. And again, when I lost my sense of smell completely. And multiple times over the years with a number of other symptoms, trying to get to the bottom of what my problems really indicated. I think there's a tendency amongst doctors to treat what is in front of them without reference to previous or existing conditions. Doctors are too busy to read and digest everyone's medical notes, so they end up dropping the ball. They can also be very rigid in their thinking and not think outside of the box. You'd think that in this day and age there would be a piece of analytical software that looks at your health record, which is now all online, and highlights instances where symptoms would suggest a condition that hasn't been diagnosed. It isn't rocket science. I know there are apps available that can successfully detect Parkinson's by analysing your voice or your typing, so analysing your symptoms would seem simple in comparison. Maybe I'm being unfair. Parkinson's isn't a straightforward diagnosis because it presents itself differently from person to person. But still, there are enough symptoms to look at, so you'd think that when you ticked a certain number of boxes, alarm bells should be going off somewhere. I guess I complicated my own diagnosis by insisting that my initial symptoms were caused by the mercury amalgam fillings in my teeth. You wouldn't believe how many awkward silences are caused by mentioning that. A young doctor that I saw in 2002 just sat and stared at me in silence until I said something a little less controversial. I still believe that I have a sensitivity to mercury amalgam and other dental metals, and it is that sensitivity that triggered my Parkinson's disease. I had all of my amalgam fillings and all dental metals removed in the mid to late 1990s, following which the tremor in my legs mysteriously disappeared and the tremor in my hands dramatically reduced. That tremor could not have been Parkinson's tremor because Parkinson's is progressive, so you don't get better. That really caused some confusion amongst some very senior neurologists and movement disorder specialists later on, I can tell you. Eventually I saw a neurologist who diagnosed Parkinson's, but this was after my symptoms had progressed significantly, following some dental work in which the dentist installed some bridges that contained dental metals. So that'll just be a coincidence, won't it? One of the tools used by doctors in the diagnosis of Parkinson's disease is medication. They feed you Parkinson's medication, and if your symptoms improve, you've got Parkinson's. Funny that none of the Parkinson's medications had any effect on my symptoms whatsoever. They did make me feel very unwell though, and yet they still delivered the diagnosis of Parkinson's. It was only when I was evaluated for deep brain stimulation surgery towards the end of 2015 that they gave me a Parkinson's medication which did have any effect. Up to that point I was unsure that I've received the correct diagnosis, in spite of my symptoms suggesting it. Unfortunately, I couldn't tolerate that medicine and had to discontinue it after about 6 weeks. Time for me to stop waffling on. More waffling next Friday, so see you then and have a great week.